Okay.
Yeah. First of all, could you do a quick interview about yourself?
Sure. My name is Dr. David Adler. I'm a doctor of chiropractic. I've been coming up on 34 years of practice. Excuse me one second. My phone won't stop ringing now.
Fine.
And I've had a practice in New York City for almost 4 years, and then I ended up meeting somebody from the South, and I moved down here back in '94. So this August will be my 30th year in my office at New Visit, and you know exactly where it's located in Roswell, Georgia.
Right.
That's a nutshell.
That's really good. More than 30 years of treating these issues. Professional. We like it. And the first question will be, what is the typical process of diagnose and treatment you will use, and what method do you use? Can you walk us through some examples?
Sure.
You can
As you
use me
know,
as an example.
we have our intern in the office right now, and
Yeah.
that's one of the things we train with them is they get an experience to be out of the academic surrounding and into a live clinic. And so we teach them how do you take what you learned in school and then transfer that or transform that into clinical practice. But as a nutshell, it always starts with collection of data. It's crucial for a patient history and consultation to find out all about that person, not just their condition, but what their lifestyle is, have they had any prior injuries, um, how long has a problem been going on, and just kind of put together a piece that dictates a lot of what I'll do in exam, as well as what I would order diagnostically, whether it just be the x-ray we take in our office, or if I need further imaging. So history is paramount. And sadly, one of the things that's lacking in today's healthcare environment, because that's very algorithm driven by a symptom only.
Okay. So it looks like uh the treatment hasn't changed that much since from your time to right now, right? But still like
We stay what we're trained to do in the beginning, and where all doctors are trained is listen to the patient, find out what's going on, get that history.
of
Don't gloss over anything because a lot of times problems, if you fall down a flight of stairs and you break your leg, cause and effect, pretty obvious. Get hit by a car, cause and effect. But oftentimes people will come over and say, well, all I did was bend down and pick up this paper clip and I heard a pop and I couldn't move. We hear that often. And consequently, it wasn't that one time and it wasn't that paper clip. It was a bunch of things. Think about heart disease. You don't get heart disease from having one bad meal. It's really a condition that's growing over time.
that's right. Yeah. Okay. Perfect. So our next question, do you collaborate with other healthcare professionals to ensure comprehensive care for your MSDS patients?
Yes, we not only work and have referral sources, but we co-manage cases, meaning I'll do my part when they do their medical part if needed. Matter of fact, I just had a patient come in yesterday, examined her, and it appears that she may have herniated a disc. And so I immediately turned around, got everything over to my colleague who works for a neurosurgical clinic and let them start the process. It's not always cut and dry just to order an examination and find out data. It's better for the patient to co-manage. Some people, I get referrals for them because a lot of patients don't want the injections. They do not want surgery. Well, now what do we do? So yeah, we regularly co-manage and work and refer when necessary.
Okay. Yeah, that's exactly what I'm thinking. I don't want an injection. I don't want a surgery.
Fine.
Yeah. Okay. So
And let
our
me
next,
add one thing to that. We see it often now, not like 10 years ago, but patients with one initial onset or just a couple of episodes of lower back pain. And a lot of times they're going right into injections or trigger points when I feel that's completely unacceptable early on. A lot of times those injections and medications, even oral medications, they don't change biomechanics. They are strictly
right,
changing a chemical reaction so you don't feel the pain. And I
right.
always use the analogy, you would never ever cover up a check engine light.
Yeah, I have deep understand of this part. Like they just keep giving me some like medicine, doesn't help. Like it helps at that times, but after like 6 or 8 hours, the pain getting back. So
Don't get me wrong, there's a time and place for other healthcare disciplines to do their work, but after 34 years of doing this, I see a movement towards you hurt, take this without really even a consultation or examination that's thorough. When I got injured and I herniated 3 discs in my neck from a car accident, some of the doctors were simply amazing, I saw, and some of them said, let's just get you scheduled for surgery without even touching me at all. So, I've seen everything. So I was at the patient side, and then I'm also at the clinical caregiver side. So I see it both.
okay, interesting. Really good to know that. And our next question gonna be, what challenge do you met like during the process for diagnose and treatment as like a chiropractor? You've been 30 years and you treat like more than, I will say, more than 1,000 people. So like, what's the challenge you have?
Um, Differential diagnosis is really the challenge for any doctor, is what we're seeing the cause of the problem. If it looks like a dog and wags its tail like a dog, it's probably a dog, but sometimes it's not. And we have to figure what that is. For example, somebody comes in with neck and arm pain. Does it mean it's a pinched nerve, or could it be cardiac? So you have to do certain tests. And if it is, make the appropriate referral. But
So,
unfortunately, that is not always a two-way street.
okay. So quick question about that part. Uh, like I know right now a lot of patients are kind of like uh, you know, afraid about those all kind of like body examinations because it's first of all it's taking like too long to get like the report. Also like uh they don't have enough background or knowledge to understand what happened to their body. They're afraid to go like, what happened, doctor, like, lie to me, what happened, like, something that happens. Do you have any like this issue before? Like the patient doesn't believe the doctor, or a patient like, gets something wrong, understand wrong about you?
Well, I can answer for me. And I think being my patient, that I am very thorough. I want to make sure a patient fully understands their condition,
Right,
go
right,
over the
that's true.
x-rays, educate them, and make them part of their care because it's important. I can't speak for other doctors. I've seen some outstanding clinicians, and I've seen people I would never ever go to. So I always tell people when they say, I went to this doctor or that doctor, and I tell everyone every time, don't be afraid to ask a million questions. Be your own advocate. Take somebody with you so they can listen, because sometimes when you're hurting, you're emotional, you miss things. And if they're going too fast, slow the doctor down, say, repeat that. I don't understand. If they don't want to slow down, then that's not the right doctor to go to.
Hmm. Okay, thank you. But I'm definitely like trust you, and every time you're like a father explaining everything to me. I'm like, oh my god, that's like first time having doctor really explain any question for me. I'm like, okay.
Well, I'm glad you see that. I'm honored to do that. It is something I take pride in. And you know what? When I don't have the answer, I will let a patient know I'll find it out. So I'll reach out to my colleagues. We look at X-rays all the time, and sometimes there are things that are on there, especially now that we have digital X-ray, that you can see everything, and even stuff that isn't there. You want an extra set of eyes, extra opinion. So I do a good bit of uh, behind the scenes co-management and reviewing, just to make sure that the patient is getting the best experience and best care.
Okay, okay. So now we have some question about the disorders and the issue, the illness. So first of all, uh, what was the most common muscular disorder issues you're having in your patients? Like me having lower back pain. How about other patients?
In the musculoskeletal realm, we generally see the lower back and neck. I mean, that's really the two big ones. So it could be headaches that start from that, called cervicogenic headaches. You can have sciatica, you can have an SI problem, you can have a strained facet, a part of the joint in the back and the neck that line things up and keeps them stable. So we also take care of a good bit of car accidents. And if you're in a car accident, there's very, very low likelihood you haven't injured your spine, even if it doesn't hurt. So the examinations have to be thorough enough to be able to find things that aren't symptomatic. I always say in my office, heart disease, hypertension, cancers are generally asymptomatic until they're not. And
Right.
when they are, and now you start having these symptoms, put them together, and then you have a problem. And the problem could be a significant one. So we try to look at as best we can to objectify the examination, listen to the patient for their findings subjectively, but then try to get as much data objectively with the tests, retests, and challenges that we do for the patient.
Okay. So does your patient age group having like has any changes like drop the age getting like younger or the age getting older? It is like also like a data you can share.
Oh yeah, I mean, my practice is through the spectrum. I take care of newborns from the birth because the birth itself can be traumatic to the spine, especially with the head being pulled. As babies grow and they develop, they crawl, then they learn how to fall and they learn how to crawl and climb up on furniture. So at every stage of growth and development, there's a challenge for the developing spine. And it doesn't need to be acute care or little baby Jimmy has a back pain because that doesn't really exist. But how is the body developing and what signs can we see before they become a problem? We have a saying, as a twig is bent, so grows a tree. So we want to catch that early. So look for scoliosis in a teenage or preschool or school years. We look for different things as time goes on. And I'm a culprit, and you're one of the best patients ever about this thing where we're all getting just distorted and twisted to look at our phone incessantly, nonstop. So it's across the board. I've actually had a very interesting case recently. He's in his 70s, tall man, about 6'4", 6'5", and he's hunched over, way over. And I check him, and his spine really underneath the package is in pretty bad shape. Bones are fused, the discs are gone. And even with all that, we've been adjusting him. He has said to me he's never felt better and standing up taller. It doesn't mean we're going to fix it because it's already distorted and changed. But if we can maximize function at any age, we're going to make a difference towards that patient's health.
Okay, that sounds pretty good. I mean, and also appreciate I'm the best patient of you. And we move to the next question. So, like, what are the most common pain points you see in your patients? For example, like does any patient talking about like they have problem finding your clinic? They have like a problem to reach out to you or something like that?
Well, the internet's everything, right? So Google's got to be updated. My website's being updated and revamped in all the different, as a search engine optimization and all the other targets that Google looks at. So it makes it very easy for people to find us. Obviously, Google reviews help. But most of my practice is going to be word of mouth and referral. I don't do a ton of advertising. Patients get cards, they talk, I teach them how to answer questions when they're asked about my practice so they can not be the doctor, but the refer. And then I do my job when they come in.
Okay, okay. That's pretty good. That's exactly what I feel like because the first time we like I want to like go to your clinic, like the Google map actually messed me up a little bit. I go to the wrong axis and lead me like it wastes me another like 10 minutes to find your clinic. But after the first time, everything is like perfect. Yeah,
Sure.
yeah,
And
and
it happens, but I always try to make sure that if we see an email or a request come in for an appointment or even just a query, we're on it and get on the phone call. And we always end the phone call. Do you know where our clinic is? And even if they say yes, we reiterate it because people say, oh, wow, that's different than I had. Okay, good. We'll see you in an hour.
yeah, yes. So go to the next question. So in your perspective, what lifestyle factor contributes most to the musculoskeletal disorder problems?
Oh, that is,
And how do you determine the root cause? Is this going to be more like a lifestyle or more in genetics? Because I mean, I as a 24 years old young man, I feel like in my age, I'm not supposed to have that problem. Is that like a genetic thing or it's more like lifestyle?
Well, let me start by saying that's a great question because I think the biggest problem we have, and more so since the pandemic where people are locked down, is ergonomics, work from home. I
Right.
had patients doing 12-hour days, working from home on a dining room table with no support on a 14-inch laptop screen.
Oh my God.
And we would literally do Zoom calls, and I'm like, no, go to Amazon, order yourself a 27, a 30-inch monitor, get an external keyboard, get an external mouse, use the laptop on a riser, set yourself up, because if we are developing these curves and we're stressing our bodies up and then we're stuck at home, that created a ton of problems for our patients. We have the same problem with children. They're on their phone nonstop. They're on laptops in school. They're on iPads when they get home. Growing up, I'll be 58 next month, in April rather. And, there was no such thing as sitting around. We were playing football, riding our bike, whatever it was. And now you don't see kids running around. It is a problem, and it's going to be a bigger problem. My prediction is we're going to see problems that we used to see at 50 and 60 years of age with spines statistically in 25 and 35-year-olds in the future because they're not getting what they need. As what was your second part of your question?
So, how do you determine the root cause of the musculoskeletal disorders?
Goes back to your first question, which was history. Find out about what the person does, find out where they work, find out how they do it. Do they exercise? Don't exercise? When's the last time they exercised? And let me say this, great exercise, personal trainer on a poorly functioning spine is also damaging. It's like putting tires on a car that desperately needs a wheel alignment. You wouldn't do that without doing both. So you have to look at every aspect, not just their complaint and what you can do to reduce their complaint. It's more about changing a habit
Okay,
to the extent we can.
right. That sounds exactly like me. But
Sounds like you may
yeah.
have heard that in my office before
Uh,
too.
oh yeah, yeah.
Yeah.
Okay, we can move to the next question about the treatment and lifestyles. What advice do you have for individuals looking for prevent musculoskeletal disorder and to continue have like a good spine on their body? So what can you recommend to do with it?
Well, let's use either dentistry or orthodontics. So orthodontists are going to put metal on your teeth to realign your teeth. And when they're done, they'll take those off and put a retainer. In chiropractic, and let's use more at dentistry, they teach you about oral hygiene, flossing, brushing multiple times a day. So in the chiropractic world, we do it differently, but yet the same. We want to make sure you're aligned. We want to make sure you're balanced. We want to get you periodically checked. Once we remove ourselves from what we call the crisis care, get you out of pain and stabilize. Second is the transitional, critical transition, where we're teaching you exercises, changing habits, maybe changing ergonomics of your desk and your environment. And then last is just what we call in our office lifestyle care, just making sure you are checked periodically, but you're also doing these other things that are positive. A patient cannot get a great long-lasting result unless they participate in it. And you might have received emails with exercises, right?
Right.
So we spent a couple of months creating not only the videos and also the dialogue that goes to the videos, but the downloadable PDF for each of those exercises. And I picked the top 10 exercises that if I can get my patients doing a few things, I consider that a home run. But we got to the point where we were spending so much time reviewing these exercises and showing them, and then they would go home and do it wrong or forget. So we created a reference that's freely available to them to use at any time, and it's been incredibly successful. But it takes effort, work, and understanding and dedication to make the long-lasting changes.
Okay. So it's all about self-management.
Yes.
Okay, yeah. Wait. So talking about management, uh, where do you see room for processing how muscular disorder are like prevented and managed managed that things
Okay,
like
so I'll be biased. Obviously, it's going to start with proper alignment biomechanics. We want to make sure the spine and nervous system is clear to do its job. Once that's done, stretching. Do a
stretching.
routine of stretching.
Right.
Maybe it's yoga, maybe it's swimming, maybe it's Pilates. I'm not against weightlifting at all. It's very important. I think as we get older, we need to do more of it to help prevent and slow down the effect of osteoporosis or changes in bone density. But it's about, I try to figure out what the patient's really going to do and then apply that at the least common denominator. Do something.
Do something.
If you're trying to give you 55 things to do, you're not going to do them. So now we're back at square one.
Right. Exactly. But like not, but the same, like not everyone always have like the time to doing that. Like for me, as example, I really try my best to follow exactly what you tell me to do. Like try to get some exercise, try to get some stretch every time, like every 45 minutes or so. But still, like when you have like it, when you're busy in something, you kind of like forget that.
Mm-hmm.
So how like do you see anything that can help with it?
Yes. Set up a reminder on your cell phone. I tell people every hour, set a timer and just get away from your desk, stand up, do a basic, simple movement stretch, change your position from hunched over in front of a keyboard, move. And then you start doing it. And as far as time, there are times where you can't move. You have no choice. You got to do something. But I find some of that is a little bit of an excuse because you put ear pods in, go for a walk for 10 minutes. It's not like we have to stop, do a 45-minute drive, go to the gym for an hour and a half, do another 45-minute. You can't. That's not realistic today. Unless you can. If you can, then do it. But the reality is we are kind of crunched for time. So it's about doing something and doing it more importantly with consistency.
Okay. And talking about after talking about management, we're jumping to the education part, education awareness. So how do you help educate patients on preventing or managing chronic illness on their bodies, and how like being as a chiropractors, like how can this professional skills improve overall awareness and understanding of musculoskeletal disorder with the communities?
I take a multi-pronged approach because there's only three ways of learning, right? Visual, hearing, and touch. So in the
Right.
office, we've got models. We've got software that shows you the movement of muscles and nerves and how that looks. But most of all, I have a patient do what I'm asking them to do and then watch them repeat it. And then remember on the subsequent visits to make sure they're doing it. It is all about training. You know, we live in a world that if we have no symptoms, that equates to being healthy, and that's not accurate. It's just not there yet. So we want to make sure we're proactive on everything we do. I'll give you an example. I shoot photography, and sometimes after I do my pictures, I want to sit and process them on software in Lightroom and stuff like that. And if I take 400, 500, 600 pictures of something, I could sit in front of a computer for 4 or 5 hours and go through them. What's bad? What's good? How can I tweak this? And before you know, you get up and you're hunched over at 30 degrees. You can't sit. So I have to make myself aware of doing the same thing I tell my patients and not be a hypocrite. Get up and move. It's crucial. We're stuck in front of computers all day long. And again, going back to we talked about ergonomics and desk setups. You know my office. You were there. I've got the laptop connected to a box that connects to 2 different monitors, and the setup of my desk is suited both for sitting and standing. And you got to look at your position. If you're a person in front of a computer all day, you can't work off a tiny screen. You're going to pay a price.
That's
So
right.
prevention comes from understanding. From my side, it's understanding the patient, their needs, and their lifestyle. And some people, they have health issues they have to get over. It's hopefully inspiring them to make some changes, whether it be just walking and changing your diet and slightly losing some weight here and doing stuff like that. And we talked earlier about other doctors and working with them. When I work with patients, and I know that we've stabilized them and they're feeling better and they're doing well, but they're just not getting that strength up, I will refer to my physical therapy friends. They're awesome at helping with rehab. That's not something I do in my office to the extent that they do it in theirs. So it really is, sometimes it's a multidisciplinary approach.
Okay, so there's collaborations for sure, and also educations, definitely. And uh, still talking about like education, I got one more questions want to
Mhm.
ask, which is like, when you doing like the patient's education, what was the first thing you always want them to learn, or what was the order when you're doing educations?
I will tell you, and it happens often, and as I've been more seasoned as a doctor, I didn't end up with this question at the end of my report after their first visit, is make sure they understand what they're looking at on the X-ray screen. I have done a full report and I was talking about that lower back and they said, so that's my neck. And then I realized I missed the boat. So we have models. We make sure the patient sees the model, sees their X-rays. X-rays are two-dimensional. Models are three-dimensional, so they get to touch it. And then I'll ask them to, touch the area in the neck that I'm talking about on their person. So they see it, they hear it, and they literally feel it.
Goes through all like touch, read, and
All
hear.
of it.
It's really okay, nice. And some modern technology questions. So can you discuss or share any technology tools that you're using during your treatment and that gave you the positive impact? I
Yes.
know the laser therapy are very helpful, but is there anything else that like you can share?
There are different emerging technologies are coming out because of computers and diodes and all these other wonderful inventions. The laser has been incredible. We use it in the office. The reason why I got it is because of an injury that I had,
Mm,
where I got really badly injured and it wasn't clearing up, and I ended up having some treatment at a seminar and then a colleague's office. And within a week, I said I need to have that in my office. I chose laser, the cold laser, because of its safety factor, as
mm,
well as its lack of contraindications. For example, there are certain things we can't use the laser on, which is obvious. Like we wouldn't really necessarily jump on using a laser on a pregnant woman. We just don't have data on that. We wouldn't use it on somebody with known metastatic disease because it does increase cellular activity. But there are other technologies out there, shockwave, sound wave type therapies that are really effective at helping the body heal, but they had more contraindications about what you should and could not do it on. I use in my office the other instruments, not just the adjusting, the manual adjusting, the electronic arthrostim instrument, and the vibrocussor. So the collection of all these to deal with different segments of our body and different layers of old injuries help me get to the core cause. Everything in my practice is based on the function and alignment of the vertebra, a subluxation or not subluxated, and the effect of the nervous system. And you know firsthand that we also do a lot of pre and post checks to make sure that we're actually making the change, because the symptoms sometimes lag, but we want to make sure that we're going in the right direction and the patient sees the change then and there as best we can.
that's okay. That's something I never think about it before because we talked about like the pregnant women or like someone maybe not cannot be used on that part. I was like, okay, I don't know that, but yeah,
Yeah,
that's really helpful.
it's not that they can't be used. We just don't have all the
Enough,
data to say, hey, this is totally safe.
oh, like not enough data to prove
Yeah,
it.
exactly. And
Okay.
and and in my office, we like you asked me a question earlier about what's my demographics are.
Mhm.
And I also right now I have 5 women who are pregnant in different stages of pregnancy. And one of the best things for a pregnant female is to make sure that their pelvis is aligned, the spine's aligned, and their body is balanced. And throughout their gestation, as their body gets bigger and their center of gravity goes more forward, they
Right.
get different conditions and problems.
Mm,
And in the medical world, it used to be take some Tylenol. Well, that's really, I never felt was safe and is not really something they want to do anymore. So
right.
we are very happy to help these women, and they are happy because they don't have the same problems, complications, and irritations they've had prior pregnancies, typically speaking.
Great, great. And here we have the one last question, which
Mhm.
is kind of related to our topic a little bit, which is how do you think about like AI being incorporated into the diagnosis or treatment process of MSDs? Do you have any like?
Well, I actually, in our trade magazines and stuff that comes out, we see a lot of AI for note-taking, which
Oh,
I'm quite intrigued by because it's able to, more accurately dictate or listen to your dictation and save you time, which is saving time equals helping more people.
right.
There are some AI software coming out on the radiography side that are able to look at films and scan them with incredibly high accuracy, so that things that I might question, it would say, no, don't worry about it. Don't really trust that yet, and I trust trained eyes of a radiologist or a chiropractic radiologist to look over films.
Okay.
But there's some interesting things coming up. They both intrigue me and scare me at the same time.
Mm, okay. And how about like the AI being used as like as a tool that helps patients to do their like self-management on daily life? Do you think that will be helpful?
Oh, I wholeheartedly believe there was a technology I tried years ago that connected to your shirt,
Right?
would give you a haptic response. Once you set your normal height, tall posture, if you were to start to slouch, it would actually buzz and say, hey, stand up. And then it would talk to your phone and give you an analysis of how often you were slouching.
Okay.
Um, that was a really cool tool. I actually used it, and it was both great and negative. The negative part is I'm bending over a lot during the day taking care of people.
Right.
So it was going off all the time.
Yeah.
But it did train me in my non-working time to have a very good posture because it gave me that biofeedback. There are instruments in the chiropractic profession that you might not know this, that actually they have intelligence where they will put a small uh, tap into the spine and it will predict what areas need to be adjusted,
Mm,
and then adjust them with an instrument, and the doctor doesn't use his hands to analyze. Personally, I don't like that. There's some good and there's some bad. Not at this point, especially, I don't think there's capabilities to look at the entire picture, but just as several criteria to decide to do something or not.
okay.
A well-trained healthcare provider is far better.
Okay. So it looks like the AI, they have benefit, but most of the problems like not smart enough.
I think AI would be a great assistant. I think eliminating any healthcare provider
Right.
or any business that may use AI, taking out the human factor. AI maybe one day be able to read facial expressions and body expression and know to have some more empathy. AI may not be able to ever understand that somebody's stress and anguish is coming from the loss of a loved one because it has no emotion. And these are the things that make a doctor and a clinician who they are. It's
Yeah.
not just the treatment.
That's a deep answer. But
A little
yeah,
too much for the morning?
oh yeah. That will be it for today. And once again, thank you so much for joining us for this interview. And for sure, everything you said is very helpful. And this uh this recording, I will like export and send you a copy of course.
Right.
And basically, that's all we have. Do you have any question to us? Or like,
First of all, thank you for the opportunity. I love teaching. As a matter of fact, doctor means teacher. And so I learned a lot today, and I'm hopefully some of the stuff I shared is going to help others. Look forward to seeing the video. We'll see you on your follow-up appointment.
yeah,
And that is not a HIPAA violation because you have stated you're already a patient. And if you have any other questions, follow up, just let me know. And I look forward to seeing how this interview is going to be used in your research data.